Uterine fibroid embolization, the non-surgical alternative for fibroid treatment, can be life-changing for some women but not so beneficial for others. Before you decide, it's important to know which category you fall into. Hi, I'm Dr. Vikash, Senior Intervention Radiologist trained in AIMS with international experience. Just like any medical treatment, fibroid embolization also has its benefits and limitations. In this video, I'll explain you honestly about fibroid embolization, where it does well and where it falls short, so that you can decide if it's the right option for you or not. Uterine fibroid embolization is a non-surgical, minimally invasive procedure wherein we do not remove the fibroids but just block the blood supply to the fibroids and uterus. Without the blood supply, the fibroids gradually shrink over time. There are no large cuts or removal of uterus, and thus recovery is much faster than surgery. Let's start with advantages. One of the biggest benefits of fibroid embolization is that it's a minimally invasive procedure performed through a tiny pinhole either in the wrist or in the groin. As there are no large incision and you're gentle on the body, the recovery is much faster as compared to the surgical procedures. Most women return to their normal daily routine activities much faster. Another major advantage is that the uterus is preserved. For many women, this is important, not just medically, but personally, emotionally, and culturally. Fibroid embolization treats all the fibroids at once, so even if there are any tiny seedling fibroids which are not seen during surgery and can regrow, are also treated during this procedure. Thus, the recurrence rates are very low as compared to myomectomy. Other benefits include minimal scarring, negligible blood loss, and short hospital stay. For women seeking relief from symptomatic fibroids without any surgery, fibroid embolization can be a very effective solution when chosen appropriately. Now, let's talk about limitations, as this is equally important. Fibroid embolization is not ideal for everyone. Some patients have fibroids wherein the blood supply is quite low, and these patients do not respond well with this procedure. So what do? We do an MRI before the procedure, which tells us if this patient is the right candidate for embolization or not. If there is any active pelvic infection or suspected cancer, fibroid embolization should not be performed as it can complicate the treatments of those conditions. The infection needs to be addressed first and then embolization can be performed. We usually perform blood, urine tests and MRI before embolization to ensure that there is no infection or cancer. Some women experience what is called as post-embolization syndrome after the procedure, which includes low-grade fever, tiredness, vomiting. These can last for few days and are usually temporary and manageable with medications, but the patients have to be prepared to go through this recovery phase. The impact of fibroid embolization on future pregnancy has been an ongoing debate. There are some studies which have indicated there could be increased risk of abortions after fibroid embolization, but even there are risks associated with myomectomy as well on future pregnancies. There are some ways to mitigate this, and if any woman is very keen on future pregnancies, you should have a detailed discussion with intervention radiologist and gynecologist about fibroid embolization and myomectomy to understand pros and cons of both the procedures before deciding on the treatment. Finally, in women with very large fibroids, a single session may not be enough and might need additional symptoms to provide complete relief. These situations are uncommon, but they are an essential part of discussion before deciding on fibroid embolization. So, how do you know if fibroid embolization is right for you? It depends on various factors like age, symptoms, the location and size of the fibroid, and intentions of future pregnancy and general health. An ideal patient for fibroid embolization would be someone who is having predominant bleeding or pain-related symptoms and has completed her family. Fibroid embolization is not about avoiding surgery at all. It is about choosing the right option for the right patient at the right time. When performed for the right patient, fibroid embolization can significantly improve the quality of life. If you're considering uterine fibroid embolization, speak to an interventional radiologist. Understanding all available options, including benefits and risks, puts you in control of your decision. Uterine fibroid embolization is neither a shortcut nor a compromise. When chosen thoughtfully, it is a precise, evidence-based solution. If this video helped you clarify about uterine fibroid embolization, then share it with someone who might be exploring non-surgical fibroid treatment. Remember, informed decisions always lead to good outcomes.